Moline High School student Eric Navarro has lost, listen to this, 45 pounds in 6 weeks. He is a patient of Dr. Elish Karani at Quad City Pediatric Weight Loss Center. Eric is here with me now along with Dr. Karani, and we just want to congratulate you, Eric. Good job. It's wonderful to have you here today.
Yeah.
Dr. Karani, good to see you
Good
again.
to see you again. Thank you very much.
This is quite the problem in our area and all over America.
Absolutely.
Tell me how you started with Eric and how you start with a kid. That's different from starting with an adult.
Yes, Paula, we have been doing the weight loss solution for the adults for several months now, several years. And when I was studying for the board certification for weight loss specialty, in that conferences they were addressing to focus on pediatrics.
Focus on kids. Starting at what age? You call it pediatrics. What is that? How far?
Usually the guideline starts from the 2 years of age, but most aggressive things you start from 6 to 18 years of age.
And Eric, you are
16.
You're 16 right now. So tell me about this. We're going to show pictures of how you looked when you first started, 45 pounds ago.
Yeah.
Do you mind telling us how much you weigh in this picture?
325 pounds.
325.
Yes.
And now you've lost 45 pounds in 6 weeks. That seems fast. Is that fast, Dr. Karani?
That's fast, but that's what we expect, because what happens with the weight loss, if you do slowly, then the body start adjusting at the number and the metabolic rate will not significantly change.
Okay, so we're trying to change our metabolism, is what that's about. So, we have the after pictures here of how, 45 pounds down. Do you feel different now, Eric? Tell me how.
Yeah, I feel lighter, lighter of course, and like instead of thinking about food every day, like I just, at school, like what I would eat, and I would just be more focused at school.
Well, everybody is wondering, how did he do it? What are you eating that's different now from when you weighed an extra 45 pounds?
What I would eat mostly, like everyone, junk food, and like everything you would want, but now it changes, like protein shakes in the morning to eating vegetables at dinner time, and then going to the gym too.
Really? So these are things you never did before. Did you
No.
ever work out before, ever exercise before?
No.
Not really, huh?
No.
So how have you gotten away from your cravings of eating the junk food? Or have you? You still crave that stuff?
Not really. Like after a week, like I would, like first week I would want this, like I'll just get some of this since I'm barely starting, but then after the week, like you get used to it, like you want more, like vegetables, more chicken.
Well, the key to everything is the way you think, right?
Yeah,
Isn't that where everything starts? Dr. Karani, you've been here before talking to adults about how we need to think, change the way we think about food, and it helps us change our behavior. You did that with Eric.
That's correct, because we explained to him about being awareness about the program, how to be thinking, what he interests him, and he should think about more, less sedentary lifestyle, watching less TV, more active.
More active.
It's just two basic points. Replace bad food with a good food.
Yes.
And replace sedentary life with active life.
I know. See, that's as simple as it is, right?
Absolutely.
Move more and eat less, but
how do we do that?
How do you do that? How do you do that on a consistent basis? Are you going to be able to continue this, Eric? How do you feel about that?
Yeah, well, since like now I'm doing it, like I'm used to it now, so I'm pretty much still going to be able to do everything that I want to do and continue with this path.
What's your goal weight?
My weight is to weigh at least like 200 pounds.
200? And you started at over 325, you
Yes.
said? Well, we wish you all the best, Eric, and thank you. I'm glad you came on today, because at 16 years old, and showing other kids your age that they can do it too.
Yes.
Right?
Yeah,
Dr.
absolutely.
Karani, thank
Yes.
you so
Thank
much.
you.
Great to have you both
Thank you very much.
here
Paula.
today.
Thank you.